So what do we know about atypical aHUS based on the genetics is that while mutations are very informative, currently right now they do give some prognostic indication, but as everyone in this room knows, all patients with atypical aHUS tend to have a different presentation. Or at least that's what we have right now, because we have one report here and one report here. Everyone presents very differently. So I'm getting close to the end of my slide. So what I'll just very quickly say is that what do we know about about atypical aHUS right now is that it's a genetic or acquired inability to regulate complement. And when we say acquired, we're usually talking about the autoantibodies that develop in this disease. That's really the population I'm talking about there. But it does give the patient a lifelong risk for having these exacerbations that we know happen. It's chronic. And it's uncontrolled complement activation. We know that from that list of genetic research that historically that I've presented to you. We also know that it involves one of those pathways that I showed you in that cartoon, that it's a systemic thrombotic microangiopathy. And what that really means is that small blood vessels will have blood clots in them, and the patients will be inflamed, and they will have, because of the clots that are present in the blood vessels, they will have difficulty with blood flow to various organs, whether that organ is the kidney or the brain, whatever that organ is. That's one of the major features of this disease. But we also know that there are subclinical disease. There are times when there is obvious clinical presentations. There are times when there's multi-organ dysfunction and even, unfortunately, death. But there are also times when we're just impairing the quality of life because of how difficult this disease is to first of all, diagnose, of course, but also to treat and to stay on top of. Obviously, in our second lecture, a couple lectures from now, we'll talk about how perhaps it won't be as hard to stay on top of in the future because of our wonderful drug Solaris, but there's a constellation of problems for these patients that are not only medical problems, if you will.